debate. We have a woman here says, I don't want to be Europe or Cuba. Why or Cuba? Why or Cuba?
Healthcare system. I believe in freedom.
So what's wrong with the Cuban system? I heard that the UN rated the two about the same.
The UN can go where Cuba is.
I heard
the UN can just go away as far as I'm concerned.
I heard that the way they rated the systems was based on equality, and since the American system you could get good care, but if you paid for it or did a lot of work or got charity, but if you were poor you got less care. Whereas in
physician, I'm a physician. I'm a nephrologist. I take care of people that don't have any insurance. I take care of illegals that don't have insurance. They get free dialysis. So it doesn't matter. You get taken care of in the United States of America. Looking at us.
Glad I talked to you.
Yep.
Cure my ignorance. What is a nephrologist?
Medical kidney doctor.
Okay.
Praying about what would happen.
So if kidney failure and all the wonderful things associated with not having at least one good kidney, that's your domain.
Yes.
All right. Now, did you come to this event as a doctor or as a normal citizen? Like, were you inspired to come here because of your medical practice?
I came here because eventually I'm going to need some health care, and I wanted to be there for me. Under this health care reform, as it stands, the reimbursement for Medicare will become as it is for Medicaid. Doctors aren't going to be paid enough. They're not going to be seeing patients. You'll be waiting in lines. Doctors are going to quit. I quit.
You quit?
I quit. I'm not going to do this crap.
But you did a lot of free work. Yeah. You took care of a lot of people who couldn't pay.
Yeah.
So now these people, the people you were taking care of, where do they go?
No, there's a huge group. A huge group of doctors.
So there's still a group of people that provide free care.
Oh, yeah.
But the number of patients that can get that free care is reduced by the number of patients that you could treat because you don't want to operate under the healthcare law. Is that a fair assessment?
I don't think so. They're going to be taken care of regardless.
Well, you still, each doctor, right, can care for only so many people.
Exactly. That's why this is really a disaster. There's going to be less doctors. There's going to be tons of more patients coming up. Long lines. Waiting to see a doctor. You want to see a doctor soon. You're going to be told you can't. It's going to be a disaster.
So more doctors are going to go the route you did and just leave the profession. Yeah. Even doctors who did charity work, which will reduce, not enhance, the number of available doctors. Am I mistaken?
Exactly. And that's not a good thing.
What did you think? The president, very early on in the debate, said doctors like to inflate the cost of their services by doing certain things. You're a physician. Did you ever see any dentist or ENT decide to do a tonsillectomy when you could just do,
no,
some ice cream?
No.
Never?
No.
Never anything like that?
Ever.
Not a single thing like that?
Never.
How long were you practicing medicine before you left the profession?
3 years.
So in 30 years you didn't see a single doctor say, well, it's in the patient's best interest that he takes a pill, but I can make a whole bunch more money off him if I put him in for surgery.
No.
It's never happened. Not once.
Never. Not once. Zero. My crazy.